Hello, my name is Leslie Royal Pryor. I'm the Primary and Community Nurse Lead for Greater Manchester. Together with my colleagues Kerry Porter and Johnny Henderson, we're going to tell you a little bit about the CARE programme today. So as you may remember, 2021 we ran the CARE programme in Greater Manchester for 40 nurses, general practice nurses, and today we'd like to show you the benefits, the highlights of our amazing 2021 nursing cohort. So we'll discuss something around the wider outcomes and benefits of the programme and how the impact of their quality improvement projects are supporting population health in their localities. We'll also see why it's important to us and to replicate the programme and why care is needed both personally and professionally for our individual development. So what does CARE stand for? CARE stands for Connected, Authentic, Resilient, Empowered. Keep those words in the back of your mind because they will come up time and time again. In 2017, the Chief Nursing Officer for England launched Leading Change and Adding Value. It's a national framework to support nursing colleagues, whatever their role, to lead, influence and innovate, enabling nurses to understand the importance of measuring outcomes of work and ensuring quality and compassion are at the heart of practice. In the same year, the CNO launched the GPN 10-point plan to recognise and develop nursing roles that had transformed care in general practice, aiming to meet general practice workforce challenges by recruitment, retention and return to practice. The plan set out work to increase the focus on personalised care in the community with a stronger focus on prevention and population health to drive better outcomes and experiences for patients. By raising the profile of this highly skilled workforce and highlighting the leadership potential of all the nursing workforce to lead change, improve quality and compassion in practice, here in Greater Manchester, we wanted to build on this and extend these leadership roles. Next slide, please, Johnny. Here's the lovely Carol Jarvis, one of our 2021 participants, with her CARE badge there, proudly displaying it on her uniform. So again, what is CARE? It's connected, authentic, resilient, empowered. Designed to develop leaders by building on leadership skills, personal resilience, self-awareness, health and well-being and empowerment. And here in Greater Manchester, we took the offer up of the CARE programme for our nurses in general practice to ensure fair access to leadership programmes, to extend leadership roles, to support existing and potential practice nurse leaders to develop and to create potential by empowering and amplifying the nursing voice. Next slide, please, Johnny. And our aims and intentions, as I've said before, we wanted to raise the profile of general practice nursing, bring them into the fore as leaders, and here they all are, big smiley faces. Thanks, Johnny. Next slide.
So what were our aims for the CARE programme? Well, we wanted to work with the NAPC to develop and implement a leadership programme for all our GM, general practice nurses, our GPNs. We also wanted to support the development of a lead nurse for each of the 67 PCNs within Greater Manchester. We wanted to build confidence and support GPNs in leadership and in their own health and well-being. We also wanted to add a bit of add value to the services and promote quality with a project-based focus at the end of the programme that gives the experience of leadership and increases population health within their communities with a real positive outcomes, and you'll see that later on a slide with the presentation with the projects that we've done and are ongoing in Greater Manchester. Opportunities for GPNs to make a difference and become influential in their developing PCN. We all know that the PCNs are in the mature stage of developing at the moment, and this was a perfect opportunity to get our staff to develop with them and show these leadership skills. We also wanted to support the aims and initiatives of GM in regards to the BME representation, supporting diversity on programmes. So we had an initial aim of 10% representation for candidates, and this is something we're taking forward on all our programmes to get that representation from the BME in our communities. And we also wanted to give something back to our GPNs who have worked harder than ever throughout the pandemic. We built into our people's plan, so we've gone from our principles of our people's plan and embedded this within that. So we grow and train our own workforce. We're looking after our people, not only our colleagues, but our people in the community. We belong to the GM Health and Care system, so that's the collaboration and the networking, and it's a new way of working. So it's developing these skills for our staff as a new way of working. So the next slide. So for the outcomes of the programme, the slide really speaks for itself. The programme had various positive impacts and outcomes, from projects to not only the networks of primary care, community and the people in community through the projects, but also on personal health and well-being as well, and from their personal learning and knowledge. So you can see from these slides that there's improvement in learning, self-confidence, and from really our nurses really wanted to make a difference, and it shows on this slide. There is no negatives around the project that we ran. There's no one declined, if you like, on their knowledge. Everybody's improved and improved a lot, and it shows that it really have some initiative out in our communities and out in our GP practices. Our nurses wanting to be the voice, making a difference, taking things forward, leading others, socially acceptance in their communication and going out into their networks. So really positive and really positive slide. And like I said, this really does speak for itself, this slide.